Hello and welcome everyone who's joining us now. Welcome to Season 5, Episode 6 of Gateway Center of Excellence in Rural Health's virtual lecture series. Today's date is January 7th, 2025. Happy New Year, everyone. And the topic for today's lecture is Benefiting Rural Area Volunteer Emergency Firefighters, the Brave F Project. My name is Sage Milne, and I'm a research assistant at Gateway Center of Excellence in Rural Health, a community-based not-for-profit that aims to promote the health and quality of life of rural residents through research, education, and communication. Rural, remote, and Indigenous communities are often the first to smell smoke and feel the heat by increasing incidents of raging wildfires. As of 2022, there are 90,000 volunteer firefighters in Canada, many of whom serve rural communities, representing 71% of the total number of firefighters across the country. They do valorous jobs for communities, ranging from providing emergency responses, such as emergency first aid, they fight fires, and promote good messages, such as check your smoke alarm. These volunteers are your everyday people who help others. I remember one of the teachers in my high school ran out the door from a class to take a fire call, and growing up, a coach on my sports team let us climb up to the top of the fire truck after we won the biggest game of our year. And one of my own family members is a firefighter for his own community. In July of 2023, a firefighter from the community of Bayfield passed away when responding to a distressed boater. Gateway is run by volunteers and passionate people. One of the research assistants at Gateway and Bayfield resident Maitland Roy began to organize a group of people, including Dr. Mike Beazely, Dr. Feng Chang, and Dr. Ken Milne, to ask the question of what can we do? Gateway decided to initiate the Brave F project to promote the well-being of firefighters within Huron County and other rural areas. Maitland and I began to dive more deeply into the research into this area. And by reviewing the academic material, we discovered there's an overall lack of material related to understanding the rural experience of firefighters. So the next steps for the project included going out to meet the fire chiefs. And I talked to many fire chiefs across the region, and this resulted in screening events. To discuss this project in more detail, I will introduce two important team members and project leads, Meagan Tamming and Neeliah Lewis. Meagan Tamming is a research assistant at Gateway. She graduated from Lakehead University with a Bachelor of Science in Psychology. She is currently pursuing her graduate degree in human resources. Meagan has developed a passion for rural health issues, particularly within Indigenous health and substance abuse prevention. Neeliah Lewis graduated from the University of Western Ontario with a Bachelor of Health Science. During her academic career, Neeliah has developed an interest for rural health issues with mental health and well-being, preventative healthcare, and health ethics. To thank those that are ongoing attendees to the lecture series, we offer certificates at the end of each semester to those with perfect attendance to recognize your commitment to and involvement with this educational series. Throughout the lecture, we encourage you to ask questions of the lecturers. Add your questions to the chat box below, and they will be addressed.
Okay, so good afternoon, everyone. Thank you for being here today. My name is Neeliah Lewis.
Sorry, I'm Meagan Tamming, and we are research assistants. I'm a research assistant at Gateway Center of Excellence in Rural Health. And today we wanted to share with you our important initiative, Brave F, which is also known as Benefiting Rural Area Volunteer Emergency Firefighters.
We are excited to share with you the work that we have been doing to support the health and well-being of our local rural firefighters. Our project Brave F aims to improve cardiovascular health among the 360 volunteer firefighters in Huron County. Volunteer firefighters account for 71% of the total population of firefighters in Canada and are vital to our communities as they respond to emergencies and provide critical health and safety services. Unfortunately, these volunteer firefighters often do not have the same access to resources, training, or health initiatives as their urban counterparts.
This has become painfully evident in our community after a local Bayfield firefighter lost their life in a medical emergency while responding to a call in 2023. Unfortunately, health risks like sudden cardiac events are not isolated to our county, as 82% of firefighters have shown evidence of coronary heart disease. In response, Gateway has developed a community-driven health initiative aimed at preventing such tragedies from happening again.
Our goal for Brave F is to provide free, confidential medical screenings and education focused on cardiovascular health, specifically for these brave volunteers. By addressing the health needs, we are not only supporting the firefighters, but also enhancing the safety of the communities that they protect.
Health indicators that we have been assessing during the screening event include blood sugar, blood pressure, blood oxygen, waist circumference, weight, height, and heart rate. All these tests are completely confidential, which ensures the protection of privacy of the participants. We also conduct a background survey and a post-traumatic stress disorder survey that is also known as the PCL-5. This survey is completely anonymous and is not linked to the participant numbers.
We believe that by supporting our volunteer firefighters, we are strengthening the entire community. So far, we've done 4 screening events in Bayfield, Seaforth, Brussels, and Ethel, and we are hoping to continue expanding throughout the entire county.
This work matters because firefighters are an essential part of our emergency response system. Their work is physically demanding, mentally stressful, and often underappreciated. Yet there is very little data on the health of rural firefighters in Canada, leaving an important group underserved. This project aims to address the gap, ensuring that firefighters in rural areas receive the support and resources they need to stay healthy.
So these sessions typically are held in the large apparatus bay of the fire hall, regularly used to hold the fire trucks and emergency equipment. These sessions usually begin around 7 p.m., aligning with regular training nights to best accommodate the firefighters' busy schedules. Upon arrival, the firefighters have the opportunity to check in and decide if they would like to participate. Participation is entirely voluntary, and we encourage the firefighters to join in as much as they are comfortable with. The night begins with an educational session led by a healthcare professional who specializes in cardiovascular health. This session covers essential topics, including health risks associated with firefighting, and this information is critical to help the volunteers stay healthy and informed. After the educational session, we open the floor for health screenings. These assessments are completely confidential, and the firefighters can choose which tests they would like to participate in. They are welcome to skip any assessments that they are not comfortable participating in, as our priority is to make the firefighters feel at ease and to ensure that we gather the most accurate results possible. At the conclusion of the screenings, we host brief focus group sessions that allow us to gather feedback on the event and identify any gaps or additional information that may help for future screenings. Finally, as we wrap up the evening, we offer a photo opportunity for the fire departments. This is a great way to commemorate the event and celebrate the participants' commitment to health and wellness. We're going to pass it off to Mike. So Michael Beazely is an associate professor at the School of Pharmacy at University of Waterloo. He is a pharmacologist and neuroscientist interested in understanding brain cell function and dysfunction in psychiatric and neurological diseases. Professor Beazley's research also includes educating and evaluating interventions for substance use prevention, harm reduction, and treatment in pharmacy and other health professions. He joined Gateway in 2023 as a board member and as a research chair in rural substance use.
Thanks, Neeliah, and thanks, Megan, for the introduction of the project. So I'm going to just spend a few minutes talking about some of the tests we're doing in the screens and why we've chosen them. So partly it's for feasibility and partly it's to provide health information back to the volunteers. And we're also collecting some of this information confidentially for research purposes. This is just a picture of the cardiovascular system. The cardio part's the heart, the vascular part is the blood vessels, and it's an important system in the body because it takes nutrients and oxygen everywhere in the body. And so if you start to run into cardiovascular dysfunction or suboptimal function, you run the risk of lots of adverse health outcomes. So cardiovascular events like myocardial infarction or heart attacks, strokes, and even organ damage such as kidney damage. One of the things that we measure is blood pressure. Everyone's probably had their blood pressure measured. It's the first thing they'll do at a doctor's office or a nurse practitioner's office. You can do it at home. You can do it at the pharmacy, at the blood pressure machine. And one of the reasons that blood pressure is so important is that we have really strong data that correlates higher and higher blood pressures with a higher and higher risk of adverse cardiovascular events like heart attacks and strokes. Now that we just do one or two measurements, so we're not diagnosing anyone with high or low blood pressure, but we're providing the volunteer firefighters with a data point. And if it comes back high, it may be something to check in with their primary care provider, or start testing yourself when you're in the pharmacy next time. Other things we talk about, we don't test for cholesterol, but we talk about cholesterol. So those blood vessels with that sort of yellow gunk in them is something that actually happens naturally with aging. But if your cholesterol is high, it happens faster and to a greater extent. And you can get to a point where your vessels are just kind of gunked up with stuff because of the cholesterol, and that increases your risk of poor blood flow or heart attack and stroke and that sort of thing. We do a blood glucose measure as well. There's lots of different parameters for measuring blood glucose. We're just doing, again, one data point. We're not asking the participants to fast or anything, but it is giving them that one data point of their blood glucose to see where they're at. We do height and weight. And so this is showing a BMI chart, which is one of the more common data points with respect to weight and obesity. We do waist circumference as well and do some education about height and weight. The background survey also collects information about several things, so sort of demographics. We'll have some interesting findings in a few slides from Meagan and Neeliah on things like, when did you last see a doctor or get a checkup? We also collect information on alcohol and tobacco use, which both in their own ways can impact cardiovascular function as well as overall health. We'll talk about diet and exercise as well. And a lot of this stuff the firefighters have heard before, and the general public has heard before. It's public health information, but we're kind of putting it in the context of overall cardiovascular health and overall health and well-being. And it was mentioned already, part of the screening includes a post-traumatic stress disorder or PTSD screen. Just one of many mental health screens that we could do. And one of the reasons, well, actually there's three reasons we're doing a mental health screen. One is to provide that information back to the participant and provide some context as to the screen and what it says, and whether maybe they should seek other advice or action. We want to collect this data to get a snapshot of mental health and stress and trauma experiences from our volunteer firefighters. And the third reason is that more and more we're understanding that mental health generally, depression, anxiety, chronic stress, post-traumatic stress disorder, not only cause negative outcomes from a mental health perspective, but really impact overall health, and in particular, cardiovascular health. So if you get into the research and the literature, you'll find really surprising numbers. Things like a diagnosis of depression increasing your chance of having a heart attack by not just 5% or 10%, but in some cases 35%, or in one study, 50%. So we want to assess and provide resources and support for mental health on its own, but also to make that mind-body connection to the participants and try to improve cardiovascular health by also improving mental health.
So what we have found so far in our screenings and conversations with rural firefighters has allowed us to gain valuable insight into the lives of the specific challenges that they're facing. The collection of data helps us better understand how to support their physical and mental well-being while highlighting the critical role they play in communities. These findings are based on the preliminary screenings. Some adjustments have been made to the screening process as well as the survey questions to improve accuracy and relevance. So far, we've noticed that the following trends for participant responses. Out of the participants who have completed the background survey, 89.6% identified as volunteer firefighters. This figure is significantly higher than the national average, which sits at approximately 71%. The data suggests that Huron County may rely more on volunteer firefighters for emergency responses and fire management compared to the rest of Canada. This increased reliance on volunteers highlights the importance of community engagement and the willingness of residents to step forward in critical roles despite the demanding nature of firefighting. It also underscores the need for enhanced support systems such as health screenings, training opportunities, and wellness programs to ensure the well-being and readiness of volunteer firefighters, who make up the backbone of fire services in this region.
So for participants' years of service, it ranged from less than 1 year to 47 years, with an average of 14.52 years of service, and with a majority identifying as male, and with most of them falling within the categories of 25 to 44 years of age. This demonstrates a broad range of experience levels from newcomers to highly seasoned firefighters.
The majority of participants, so roughly 93%, reported having a family doctor or nurse practitioner providing a critical foundation for routine care. The time since participants last visited their healthcare provider ranged from 1 week to 9 years, with an average of 12.69 months, or just over 1 year. And in terms of a comprehensive medical assessment, the time frame ranged from 1 week to 10 years, with an average of 25.22 months, or just over 2 years. The background survey also indicated that a majority of participants were not required to undergo medical screenings before or during the career as firefighters. 64.71% of respondents were not required to have a medical screening done at the time of enrollment in their current department, and 64.18% reported that they have not been required to undergo a medical screening since they joined their department. This highlights the potential gap in preventative health measures for rural firefighters. Of our respondents that did indicate having a medical screening done, 84.62% reported that the screenings were related to driver's license requirements. 7.69% of these respondents were screened for age-related requirements, and another 7.69% were classified under other. These statistics suggest that the health screenings for rural firefighters in Huron County may be related to driver's license eligibility rather than routine or preventative measures. Remember, 93% of these respondents indicated having a healthcare provider, so having a limited access to healthcare may not be the reason for low levels of routine health assessments.
Rural firefighting often involves responding to emergencies within the community, which can add emotional complexity to their responsibilities. Of our respondents, 58.82% of participants reported it was possible that they would know the person or residents that they were responding to. 35.35% said that they would likely know who they were responding to, and 7.35% reported it was almost certain that they would know who they were responding to. So these personal connections that rural firefighters have with their communities can be both motivational and challenging in times of crisis.
Background survey also indicated trends related to smoking and alcohol consumption. For smoking, 13.64% of respondents indicated that they smoke or vape, while 83.33% reported that they did not. This rate is lower than the daily average consumption of smoking for Huron County, which sits at approximately 17%. From our screening sessions, we have gathered that some fire departments have made packs to be smoke-free, which may contribute to their lower levels of smoking and vaping. Weekly alcohol consumptions ranged from 0 to 35 drinks, with an average of approximately 8 drinks per week. According to the Canadian guidelines, the recommended limit is no more than 10 standard drinks for women per week, with no more than 2 drinks per day, and no more than 15 standard drinks per week for men, with no more than 3 drinks per day. While the average consumption falls below this threshold, the broad range from 0 to 35 drinks per week suggests that some individuals may exceed the safe limit. This can increase the risk of both acute and chronic health conditions associated with alcohol use, potentially impacting their mental and physical health.
Through our health screenings, we identified several significant trends in the data. For body mass index, also known as BMI, 41% of firefighters were classified as overweight, 29% fell into obesity class 1, 15% in obesity class 2, and 3% in obesity class 3. Only about 12% of the screened participants were within the normal weight range. And while BMI does have limitations that can overlook factors such as bone density, lean versus fat, body mass, and clothing, BMI can give us an indication of the general health trends within the firefighting population. These trends underscore the need for programs addressing nutrition, fitness, and weight management tailored to their demanding schedules.
For blood pressure, 62% fell within the normal range, while 38% fell in the high range. While the majority of participants fell within the normal range, these findings suggest a need for education on cardiovascular health and strategies to lower blood pressure. Elevated blood pressure is a significant health concern as it increases the risk of cardiovascular conditions such as heart disease. While a majority of the participants were in the healthy range, the fact that over 1/3 presented elevated readings highlights the possible need for proactive health interventions. These trends emphasize the importance of cardiovascular health education, focusing on lifestyle modifications that can help manage and reduce blood pressure. Strategies such as promoting nutrition, regular physical activity, and stress reduction should be prioritized. Additionally, encouraging routine medical checkups and blood pressure monitoring can help play a vital role in early detection and prevention of hypertension-related complications, particularly in high-stress roles like firefighting.
For blood oxygen levels, all firefighters fell within the normal range of 95% to 100%. This may indicate that all the screened firefighters have sufficient oxygen circulating in their blood, which is essential for overall health. Blood oxygen levels are important to understand because oxygen levels lower than 95% can indicate conditions such as poor cardiovascular health. For blood sugar, the average blood glucose levels recorded was 5.9 millimoles per liter, which is within the healthy range, but ongoing monitoring is important to detect early signs of diabetes. Our screening events were held in the evening, typically following dinner. So during this period, it is likely that the blood sugar levels range higher depending on the diet of the individual and how recently they have eaten. This can account for some high levels of blood glucose that may have been recorded.
So qualitative insights gathered from the PCL-5 assessment revealed that sleep health and hygiene are critical areas of concern among rural firefighters. Many participants reported difficulty maintaining consistent and restorative sleep patterns, often linked to the unpredictable nature of emergency call schedules and long, irregular hours of work. The demand of firefighting, which can involve responding to calls during the nighttime hours or after extended shifts, can disrupt the circadian rhythm and lead to chronic sleep deprivation. Poor sleep hygiene not only affects physical health by increasing the risk of cardiovascular issues, obesity, and weakened immune system or immune function, but also significantly impacts mental well-being, contributing to stress, mood disturbances, and impaired cognitive performance. These findings emphasize the need for targeted interventions such as education on sleep hygiene practices, stress management, support, and adjustments to scheduling where possible. We will be addressing sleep hygiene by providing helpful resources. These resources will focus on ways to improve sleep quality, and we will discuss sleep hygiene, and it's important during educational sessions to bringing this resource to future screening events to promote healthier sleep habits. The PCL-5 assessment has also demonstrated trends related to mental health among rural firefighters. Many participants reported experiences of repeated disturbing unwanted memories of stressful events. Additionally, there were trends of avoiding memories, thoughts, and feelings associated with traumatic experiences, which can be a common coping mechanism for unresolved stress. Some firefighters also demonstrated the tendency to blame themselves or others for challenging situations, further complicating emotional recovery and resilience. These findings highlight critical needs for targeted mental health interventions, including education on healthy coping strategies, stress management resources, and access to professional mental health support tailored to the unique challenges of firefighting.
Additionally, conversations with firefighters revealed key social and cultural dynamics of rural firefighting. These individuals tend to have strong social bonds, often having close-knit relationships, spending time together outside of their roles in recreational sports or social gatherings. These connections are vital for maintaining resilient mental health. So, family connections are also prevalent in rural firefighters. In many rural communities, firefighting is a family affair, with siblings, extended family, and multiple generations serving together, reflecting a strong sense of duty and community pride. These connections can act as pillars of support, strengthening family bonds and their sense of belonging. This strong sense of duty and community pride, reinforced by family connections, highlights the importance of prioritizing the health and safety of volunteer firefighters who dedicate themselves to protecting their communities. However, the limited resources often faced by rural fire departments can make it challenging to implement comprehensive health initiatives. Despite these constraints, there are several practical and cost-effective strategies the fire departments can adopt to reduce cardiovascular risks and promote long-term wellness among their members. These measures focus on both preventative care and ongoing education to support firefighters in maintaining optimal health while managing the physical demands of the role. Some of the tactics that fire departments can do to address cardiovascular risks are annual electrocardiograms, physical exam with health history, blood analysis for cardiovascular health, heavy metal testing, annual nutrition training, annual detoxification programming, educational training on cardiovascular disease, which Gateway has created a stepping stone for the 4 fire departments that have participated by providing them with educational training around their cardiovascular health, indicating that programs like this can be easily implemented into firefighter training nights. They can also start implementing access to physical fitness equipment and time for exercise, sleep assessments and training, and stress management courses and training. Implementing these strategies can allow fire departments to take meaningful steps to protect the long-term health of their volunteer firefighters, ensuring they remain strong, capable, and ready to serve their communities.
Our next steps is to expand this program across Huron County. Over the next 3 years, we aim to screen as many fire halls as possible and to return to the fire halls who have already participated. This approach will ensure a comprehensive, ongoing support for firefighters while tracking their health trends over time. We also want to extend this work beyond Huron County. Our long-term goal is to include rural fire departments in Perth, Grey, and Bruce counties in hopes to create a nationwide movement. By doing so, we hope to build a robust understanding of what it means to be a rural firefighter in Canada and how we can better support them. Including these counties will also allow us to investigate the differences between paid and volunteer firefighters to better understand the inequalities that are present for volunteer firefighters. So community involvement is where you all come in. If you're interested in getting involved or you know someone who might want to participate, please don't hesitate to reach out. We are actively planning more screening events and we would love to hear from you.
We would also like to take a moment to thank everyone who has contributed to this project so far, from our research team, Dr. Michael Beazely, Dr. Ken Milne, and Dr. Fen Chang, to the volunteer nurses and community members, and also to the firefighters who have participated. This work wouldn't have been possible without your support and participation. We also want to extend our gratitude to our funders, including the Seaforth Legion, Branch 156, Goderich Legion Branch 109, and the Brussels Legion Branch 218. Also, 100 People Who Care Huron County and IAA Financial. Your generosity has been instrumental in making this program a reality. Finally, we are always looking for additional support to help our project expand and sustain. If you or your organization would like to contribute in any way, from volunteering to funding, please reach out to us. Together, we can make a real difference for our rural firefighters.
Well, thank you for your time and attention. We hope this presentation has given you a better understanding of the work we're doing and why it matters. Rural firefighters are the backbone to emergency response systems, and it's up to us to ensure that they receive the care and support they deserve. Please feel free to ask us any question or connect with us after the presentation. We will now pass you off to Huron East Fire Chief Jay Arns, who will be providing you with an insight on rural firefighting in Huron County. Jay Arns has been on the fire service for 20 years and is currently in the fire chief in Huron East. Prior to becoming a member of the Huron East team, he was a fire chief in another rural area in Ontario. Chief Arns has been an active member in a full-time large department, as well as smaller volunteer and composite fire departments in Ontario and Alberta. Chief Arns was a professor in the pre-service and fire science program, as well as a coordinator for several years with Lambton College. He is a peer fitness trainer and very active with the Wellness Fitness Initiative through the International Association of Firefighters. He has implemented a wellness program into the volunteer setting, adapted from the International Association of Firefighters full-time sector for fire service. Chief Arns has sat on numerous steering committees and boards across North America, helping to make fire service a better place for all members.
Well, great. Thank you. Thanks for having me here today. It's an honor to sit here and speak. More importantly, thanks for all your work and all your dedication to trying to help better the lives of our firefighters, and appreciate reaching out and taking the time to do what you're doing. The reality, I think the harsh reality is, regardless if you live rural or if you live in an urban setting, if your house is on fire, you need a firefighter to show up and do his work. And there's definitely differences and challenges between both rural and volunteer stations, or sorry, volunteer and full-time stations. I'll just kind of touch on a couple of them. Feel free to ask some questions. I think what's happening, what I see occurring anyway over the last 20 years is we're bridging a gap. So what used to be a defining line between full-time and volunteer firefighters, there's implementation of new training programs and new certifications that have been around for a long time, but revised and now mandatory within the volunteer sector as well as the full-time sectors. So typically now, when you get a firefighter arriving on a call to your location, it's going to be well trained, the same as your full-time firefighters are. Some of the bigger challenges that we face, especially me in my role in this position, is how to keep everybody safe, how to, longevity of life, and what can we do to make it better. Statistically, unfortunately, we use, one of our leading causes of death for firefighting is cardiovascular disease, and that's internationally. I mean, that's a standard right across the board. So we're challenged all the time with how do we try to fix that, and what steps can we take. In a full-time department and in most bigger centers, there's better access to things like wellness fitness initiatives. Wellness fitness initiatives are, a very large component of being a firefighter. There's, it's made up of a few different sections, one of which is, exactly what Gateway's been talking about, which is the medical component, your medical evaluations each year. It helps to build a baseline for me as a person, or for a firefighter as a person, and then we can watch for variations within that on an annual basis and detect it early enough. There's a fitness component as well. And then there's the nutrition side of things too. Now, in rural settings, volunteer fire departments, it's a little bit more of a challenge. In most full-time stations now, there's a full gym and fitness facility, or relatively full gym and fitness facility within the stations. If not, there's availability of a fitness program that you can tap into. Here, and in most rural settings, that's not an option. and very different dynamics between the two as far as you think about on a volunteer side. So in a full-time station, just to kind of concise it up a little bit, in a full-time station, you're at the station 24 hours a day. So the station is always manned. So you're always in the mindset of, at any time we could be eating a meal, you could be having a workout, whatever you're doing at the fire hall, and the tones drop and we have to respond out. In a volunteer setting, however, once the tones go, we're notified by pages and through our telephones. And regardless of what you're doing, you can be watching a football game, you can be participating in a football game, whatever that is. When the tone drops, we have to respond to the hall first, collect our equipment, and then jump on the apparatus and respond to the calls. Ironically, the response times for both, if I'm living in the station or if I'm responding from, relatively close within, there's not a lot of difference in time for response. But what it does do is add that extra stress to anybody responding into a volunteer department, because now they're trying to get from their location into the station first, which kind of elevates and increases that stress level prior to even getting into the station. So there's a few different things comparative wise. As far as training goes, full-time firefighters are daily. There's training taking place every single day, whereas in a rural setting, in a volunteer setting, it's anywhere from 4 to 6 hours a month of training, and then maybe some extra stuff over and above. So there is a few variances with the training. Again, it's all standardized now, so the training that's taking place in full-time stations is the same as the volunteer stations. So that's that gap is kind of being bridged across. We've grown a lot as well as far as equipment goes. Our equipment in the volunteer sector is exactly the same as they use in the full-time sector. So we're definitely closing the gaps. There's on a couple of different areas for sure. One of the big things that we need to think about too when you start talking about cardiovascular and issues with cardiovascular, if we're already preconditioned or if we're already not in top shape or in good physical shape, our SCBAs, our self-contained breathing apparatuses that we wear inside of a building, just because of the positive pressure inside of the face mask itself, reduces our physical capacity by 20% just by putting the mask on. So if we're already at a deficit before we put the mask on, that increase in cardiovascular certainly comes into play. How am I doing for time?
You're doing perfect.
Okay.
We can move on to the Q&A if you're okay with that.
Yeah, absolutely.
Amazing. So once again, if anybody has any questions, please add it to the Q&A button below on Zoom. And the first question I'm going to ask to Neeliah and Meagan, who have been reviewing all this gathered data. What outcome has surprised you the most in the results?
I think personally the one that was the most surprising was the length between health assessments ranging. It was such a broad range, and a lot of them were closer to a year, if not more, and being close to 10 years is quite a surprise, especially when they are in a high demanding kind of environment where their health is very important. And it was just kind of shocking to see that some of them haven't even gone for simple things like just regular checkups or any health assessment at all. It was a very eye-opening kind of thing for me.
For me, it was the length of service. The range was so large from less than a year to up to about 47 years. So that took me by surprise. The other thing that took me by surprise too was actually the amount of people who hadn't had medicals done, similar to Megan's, where there's no requirement at enrollment for them to get a medical assessment.
Thank you. And we did have a question in the chat that I'm going to direct towards Jay. How does one become a firefighter? And how extensive is the interviewing and training?
Well, thanks for your question. And we're always looking for firefighters, as you can appreciate. It's a stepped process. So first step is an application, which is done in our department online through a website. And from that application process, we will conduct an interview. We'll do a written test, and we'll do a physical element as well before we take you on board. And then once you're on board, it's a 1-year probationary period where we train you in the national standards to become a firefighter. And then beyond the first year, now you move in as a full-time firefighter in a volunteer station.
And I'm going to direct this one towards Mike about screening locations, actually. The screening location is different than a comm and medical office. Is it different that the blood pressure could be inaccurate?
Yes, that's a great point. And so what we did this intentionally. So rather than setting up a screen and sort of recruiting people to drive to the location, a central location, we really wanted to come to the fire hall and sort of piggyback onto a monthly training night that we knew that many of the firefighters would be there anyway. So, but that does mean that we're coming into a different space every time we do a screening. And so we sort of have to logistically see where we're going to set everything up. And it does increase, well, just by the nature of the screening, there's a lot of variability. So you could be coming to the fire hall after a week in Mexico at a resort, or you could be coming after a really stressful week at work or something like that. So like we do emphasize that these to the participants that these are one data point. And so getting a high blood pressure reading doesn't mean you have hypertension, doesn't mean you need blood pressure pills, but it sort of does mean maybe you should check it again in a few days or next time you're at the physician's office. And we do understand as well that what we're going to get data-wise is not sort of as standardized as maybe you'd like. If this was just a research project, we would want maybe to account for some of that stuff. But because it's a sort of hybrid research project and community outreach project, we felt that coming to the halls was the best way to do it.
And this one I'm going to direct towards Neeliah. Will you be extending this initiative to Perth County volunteer fire departments?
Yes. So as of right now, we are trying to finish up a bit more in Huron County, but we are looking to expand the project to Perth and Grey Bruce as well. And then hopefully from there, we can continue to build on and spread it all over Canada.
Thank you. And this one is towards Jay. Somebody asked, is there an opportunity for volunteer firefighters to regroup or decompress after responding to a call before heading home? They described that urban fire stations usually provide time at the station where firefighters live for 24-hour shifts, as you were communicating earlier.
Yeah, great question and a great thought process there. One advantage of being in a full-time department, of course, is that you're immersed in the environment. So when you come back from a call, you do have time to sit around a table and decompress. A lot of times in a volunteer world, we don't get that opportunity. Now, we try hard, especially depending on the type of call we just attended, but we're not always afforded the opportunity. A lot of the volunteers leave work to come to the incident, and then they return to work after the incident. So there's, again, depending on the severity, we don't get a whole lot of time to decompress afterwards. We'd like to, but that's one of the challenges that we're working to overcome on the volunteer side.
And I'm going to direct this question to Meagan. Somebody asked, there's a huge variation in many numbers, and therefore they describe averages may not reflect stats accurately. Has anyone considered using a median number rather than an average?
Yeah, we did consider it. So for some of the ones like the drinking, the average fell very close to the median. Part of it was to protect just privacy reasons because we are in the preliminary rounds. We have limited amount of participants, so we just wanted to keep it a little more broad than narrowing it down to specifics. So in terms of that, like the drinking one, it fell very similar. Same with the years of service, fell very close to the average that was used. So it didn't really, one didn't really weigh over the other. So just for the sake of our data collection, we kind of just leaned more towards averages because it gave a little more of a broad overview of kind of what we were dealing with.
Thank you. And this one, again, is back to Jay. Mr. Arns mentioned attempts to close the gap to alleviate problems from a lack of access for volunteer firefighters in terms of equipment and whatnot. Do you think there's a social pressure for firefighters to tough things out, so to speak?
Again, a great question. Great audience today. So yeah, like, you know, I mean, it wasn't so long ago that it was the norm was to not seek help and not to try to get any, you know, I wouldn't say weak, but you were in the minority of reaching out for help, especially mental health. Whereas today it's the actual inverse. I mean, it's a 180 all the way around. I do feel that there is maybe a little bit more of that, but the gaps, more importantly, that I was discussing, or mentioning, or trying to close, were more related to the health and safety side of things, and how can we have a longevity of life for firefighters beyond a 60-year retirement, 65-year retirement, to have a comfortable life. We've got 19 presumptive legislated cancers known as occupational hazards with us as firefighters. So we're working harder to close those gaps. We're making available more things like mental health wellness opportunities and help. So I think that the gaps were, there's still maybe some of the old school stigma of, I'm a tough guy, but we're breaking down those barriers for sure.
Amazing. That's really positive to hear. And this one is to Dr. Mike. Do you feel like this research will be publishable and affect future health of volunteer firefighters?
Yes, I hope so. I think right now we've done those 4 sessions, and really the data we've gathered and what we've learned has started to fine tune the next session. And I think we'll go through that sort of iterative process a little bit. But there isn't, and there was another question in the Q&A about data, and we don't have much data. We have some broad data generally about firefighter health. We have a little bit less when it comes to urban versus rural, professional versus volunteer, and almost none or very little when it comes to, even getting more granular, like Huron County firefighters versus, an area in British Columbia and that sort of thing. And so hopefully what we can gather is some baseline data, and hopefully that data can tailor our interventions to make them more effective. And if we can share that data, that gets that data out there so that other groups and other researchers can take a look maybe at the firefighters in their jurisdiction and see if it's the same or different, and that sort of thing.
Thank you. And I will direct this question to Neeliah and Meagan. How can you actually get involved with this project that Gateway is currently doing, and what are the opportunities?
Yeah, so there's a numerous ways that you can get involved, from funding to volunteering. So specifically, if you are a nurse, we are actively looking out for that. So for the screening process, we need volunteers for blood sugar, blood pressure, blood oxygen, all of the measurements, really. So you would help with our screening event. So we typically host a little informational session for volunteers to get them a little more familiar with the kind of work that they'll be doing. And then you come to the screening event, you would be performing the actual kind of taking down the things that we are measuring. And then we wrap it up, and that's kind of that for the volunteer work. It's very light, it's very easygoing, and it's not very hard. So if you are interested in getting involved, you don't have to be a nurse. Now, for things like blood pressure and blood sugar, it's much better if you are. But anyone can really get involved. There's ways that everyone can get involved in this.
And there's somebody that I just want to mention, said a big thank you to Jay and all his colleagues. So once again, Jay, thank you for your work as a firefighter and everybody that you work with. And this is directed once again at Jay, maybe, and somebody was asking about most firefighters after serving a call lasting many hours turn around and work 8 hours or more a day. Do you have any statistics on this? Is there anything that comes out from the departments that you know about this?
Good question, and maybe a new research project. I'm not aware of too many stats to look at, but absolutely, I think that's a great point. Something we should probably consider.
Amazing. And then this was asked a bit earlier, so I'm going to direct this to Neeliah. Did we, although we've only done 4 stations so far, is there any indication that rural firefighters have a difference to urban firefighters in the data we gathered so far?
It is very apparent to us that the resource allocation is not even. Obviously, with the urban, they are predominantly paid fire departments, so they do have more access to certain resources that the urban counterparts don't. So that's one of the things we are hoping to be able to improve and get those resources out, both for physical and mental well-being, to the rural fire departments.
Thank you. And this is to Mike. As a research, what's the benefit of doing a project over a 3-year period?
Well, in an ideal, well, first of all, it'll take us some time to get to all the fire halls, and I think with time we'll be able to do more and more faster. Our goal in an ideal world is to not only do a screening in every fire hall, but to do one every year in every fire hall. And of course, we're not keeping track of people individually, so people will come and go, but that would still give us not only baseline data, but a couple years worth of data and that allows you to start to see trends. So are the demographics changing? Are there trends, positive or negative, in blood pressure or drinking or smoking? And once you see those trends, then you can again further tailor your next year's intervention to try to head off those negative trends and emphasize any positive movement.
Amazing. And then this is a question from me is, how have you been incorporating feedback from the fire departments throughout the process? And this is to Meagan, Neeliah, and Mike.
Yeah, so we are currently in the preliminary run, so we're kind of updating it as we go. So when things like at first we didn't really provide a lot of resources with mental health support, and then when the PCL5 kind of came into play, we're like, we should include those as well. So we're kind of constantly updating it and making sure that the questions that and the information that we're being provided with is kind of upgrading our answers and our questions in a way that it can kind of get at things that might be overlooked for rural firefighters.
Yeah, some of the questions too, we found that some people would be skipping over them. And so just being able to rephrase questions so they're worded in ways that people understand them a bit better. Any feedback, whether it's positive or negative, is really beneficial for us because this is to help the firefighters and the fire departments. So if there's something they like about it that they think we should continue doing, if there's something that they don't think is working or we're not getting responses in, we are open to changing that since it is still preliminary screening. So we are open to any constructive feedback, whether that's something we need to fix or something that's working well.
And this one's back to Jay about my We talked earlier, and I was so astounded at your background in acting as a peer fitness trainer and initiating your own wellness fitness initiative. Would you want to share a bit about your work that you've done?
Absolutely. So there's it's I wouldn't say easy, but it's a good undertaking to put a wellness and fitness initiative through the IAFF and into full-time fire departments. The challenge was, and again, the pieces with that are medical screening, chest X-rays and those type of information gathering to build a baseline. But now taking that and adapting it into a volunteer world was a little bit challenging, because we're not exposed to the same number of calls, although it's the same toxins and stuff we're exposed to. It's a little different call volume. So we had to look at things like how often do we do chest X-rays, that kind of stuff. So in partnership with the local health team, we were able to come up with a program that worked very, very well, where a firefighter would show up to do his annual medical. It's non-punitive and non-mandatory. It was totally volunteer. Certainly, presented as in your best interest. And an icon will pop up on the screen to let the doctor know that it was that they were a firefighter, and all their stats and stuff were in there, and it followed the program very well. So through the program, we also had gym memberships. Obviously, we didn't have a gym within our fire stations, so we offered a gym membership, and we offered counseling on fitness training and programs and that kind of stuff. The unique piece of it too was on scene, when we're actually on scene fighting fires in our rehab area. One component of our rehab is checking vitals, and having a look at things like blood pressures and your SpO2 and stuff like that. And that would all get recorded privately and uploaded into the doctor's files. So all the information, so if I was on a scene, all that information was shared with the doctor. So next time I went in for my medical, he was able to see all those stats, and we could track any trends or any changes in what we would consider the norms. So it was a great initiative. We did detect very early on a couple of level 2 hypertensions that required treatment. We did detect 2 members with cancers as well, that were, because of the screening process and early detection, they were back full duty within a reasonable amount of time. So, I look at those successes, and that entire wellness fitness initiative has a long history of just those kind of successes throughout, North America.
And somebody in the chat mentioned, thank you so much. I look forward to seeing how this information gathered now helps our volunteer firefighters in the future. So thank you very much, Jay. And is there anything else as we close up that, any closing comments from Meagan, Neeliah, or Mike? So as we wrap up, I just want to say once again, this project is an ongoing initiative. Gateway Center of Excellence in Rural Health was very lucky to have a great team of volunteers who worked together with the research assistants, which included myself, Sage Milne, Nicole Gilroy, Maitland Roy, now Neeliah, and Meagan. And we've also included a mix of current and retired healthcare providers who've served as volunteers, including Dr. Fen Zhang, Dr. Ken Milne, Gwen Devereaux, Dan Stringer, Michelle Milady Young, Anne Marie Thompson, Nancy Moore, Judy Tiger, Joanna Calamusa, Judy Ward, Cindy Flanagan, and Diane Wood. As this project is discussed further, if you're interested in becoming involved in this project or others from Gateway, please reach out to us directly at info@gatewayruralhealth.ca. A huge thank you to all our presenters, Dr. Mike Beazely, Neeliah Lewis, Meagan Tam, and Jay Arns. We would like to thank our wonderful sponsors for their continued support to this lecture series. Without them, the lecture series would not be possible. This includes McGee Motors Goderich, Hurontel, DeJaegars Pharmacy Goderich, CIBC Wealth Management, Libro Credit Union, and Tuckersmith Telecommunications. Gateway is a not-for-profit organization with charitable status, and we greatly appreciate and welcome any support we receive. Our next lecture will be on February 4th, 2025 from 12 to 1 p.m., featuring a talk from the University of Guelph on urban exodus, discussing the problem that may arise from people moving from urban areas to rural areas during COVID. Thank you once again to everybody, and we hope to see you next time.